Resignation after resignation. These medical professors in South Korea are quitting in a show of defiance. It's all in support of thousands of junior doctors who have been on strike since mid-February over the government's plans to increase medical school admissions. While officials say this will help deal with the shortage of doctors, students argue it will strain an already overstretched system. In response to the strikes, the government has threatened to suspend the medical licences of about 12,000 interns and residents. The president of the Medical Professors Association says the move will lead to even more resignations.
If the punishment against trainee doctors is implemented, the medical professors' voluntary resignation will proceed forth, and our professors will inevitably be even more willing to resign. It's clear that increasing medical school admissions will not only ruin medical school education, but cause our country's healthcare system to collapse.
The trainee doctors on strike represent less than 10% of the country's 140,000 doctors. But in some major hospitals, they account for about 30 to 40% of doctors, assisting senior doctors in surgeries and inpatient treatments. Senior staff have been left to deal with the excessive workloads. Despite the resignations, many say they'll continue to work, but scale back to 52 hours a week, the legal maximum weekly working hours. The strikes have already caused hundreds of surgeries and other treatments at hospitals to be cancelled.
Medical professionals have abandoned patients and abandoned the medical field. Any explanation now about why serious patients are neglected and why doctors' groups are using their power deserves criticism from patients and the public.
With opinion polls showing dissatisfaction with the government's handling of the crisis, there's growing public pressure on President Yoon Suk-yeol's government to end the medical impasse. Madison Watt, ABC News.